EKG poem. Let me tell you about EKGs. You'll be a pro, just wait and see. There are 8 steps, but first you should know about the conduction system and how the heart goes. Cardiac cells conduct signals that cause the heart to contract. It begins with the SA node, sinoatrial, that's a fact. It generates electrical impulses at a certain rate, 60 to 100 beats per minute. No, this is not fake. We now move on to the AV node, the next part of the system. It delays the SA impulse if there is a bad situation. If SA node's impulse is weak, AV will carry through. This impulse will be from AV only, not the SA2. If this is the case, the beats per minute may be 40 to 60. You'll know it when you see. As the impulse goes down, we move to the bundle of His. You'll know the heart does beat from here with 40 to 60 beats per minute. You can't miss. The next in line are the bundle branches, both left and right. The impulse here is 20 to 40 beats per minute. It's true. The one who now knows this, of course, it's you. Lastly, we have the Purkinje fibers at beats per minute 20 to 40. Now that we have learned all that, we'll move to the next part of the story. This includes components, segments, and intervals in all their glory. First thing we find is the P wave you see. What this shows is atrial contraction, do believe. Next we find the QRS, ventricle squeezing, that's correct. After this, the T wave persists, representing ventricular relaxing. When looking at the ventricular relaxing. When looking at the 6-second strip, 3 tick marks you will see at the top of the paper to show you 2 times 3. The 6-second strip method is a common one to see. Count the number of QRS complexes within the 6-second strip. That number times 10 gives you the BPM hip hip. In case of a strip that is not 6 seconds long, do these steps and you won't get it wrong. Take 300 divided by the number of big boxes between one R to R interval. Once you do this, you'll get your total. This is the first step in interpreting EKG. After the nurse determines the rate, it's time to move to the. What is the? Well, it's the rhythm. It may be irregular or regular, so it's important to assess them. Check the atrial and ventricular rhythm by observing the PP and the R to R intervals. And then next, we want to analyze P waves to look for consistency. The nurse is going to intervene. How are they looking? We'll see. Are they present? Are they regular? We will find out what's going on here. The next step for the nurse is to measure the PR interval. We're going to look at the seconds and ask some more things. Are they greater than 0.20 seconds? We'll check at all ends. Are they constant or less than 0.12? I guess we'll see if we just indulge. Observing is key to look for abnormalities, which brings us to the next step here. Measure the QRS duration. I swear, the way they appear should be similar. When we keep looking, it will seem more familiar. Examine the ST segment. Assess the T wave. Measure the QT interval. A life you could save. Using these steps, the nurse can then determine the heart function and make a plan. If the patient is showing a normal EKG, then we know that the outcome was fulfilled and we can continue to monitor and watch the strip. Watch closely though, we can't afford to trip.